My name's Nadine and I'm from the UK and at the moment I'm just trying to stay well, basically. I have two young children, 7 and 12. I had a melanoma removed in 1999, which I had removed from my upper arm. I didn't have a reoccurrence for 10 years until the birth of my youngest child, and that was in 2009. And since then, it's got progressively worse, and it's affected lots of different parts of my body. I've had radiotherapy, chemotherapy, lots of operations, until finally I had the virotherapy and found out about coming to Latvia. So that's where I'm at with it at the moment. It's safe, it's non-toxic, and totally different from anything that you're offered in the UK. In the UK, there are only a couple of treatments that you can have, and all of the time they're just offering you surgery. So if you have a lump or a bump, they just cut it off. So I was running out of options, basically. In London, again, when I've had I've had lots of surgery and sort of been made a bit of a guinea pig of with various vaccines and things like that. But I know it's all chemical, it's all toxic, and I just think my body's under enough pressure as it is. So to know that the injections that I'm having, the virotherapy is safe, it's non-toxic, it has no side effects. I can do my treatment at home and still get on with the day, still play with my children. I haven't got to lay down for hours. I'm not going to be ill. So it's given me a good quality of life. I liked the idea of coming here for a week and the way that you treat people or the illness as a whole person approach, a holistic approach. So it's not just treating a tumour, it's your food, your mindset, and things like that as well. So when you leave here, you feel set up to deal with it on lots of different levels. This is my third lot of virotherapy, and I do one a week at home, which is nice for me as well, because treatment back in England, you could go to the hospital every 3 weeks. You have to wait a long time for results and answers, whereas I'm in control of this. I can do my injections at home. If I have a lump or a bump that comes up, I inject around. And I would say in the last year, the virotherapy, by applying it around a lump or a bump, has taken it probably about 5 lumps down. 5 lumps down. Yeah, it's amazing. So I feel I'm in charge of my treatment. Yeah, so it's been really good. I just Googled it after watching the TV programme, after the documentary, and I came out here for a consultation, I just fell in love with the place. It's so pretty and it's a nice setting, fresh air. And everyone here at the clinic are amazing. It's just so different to what I'm used to having in the UK. So things are discussed very clearly with you here, your blood tests and things like that. In London, it's almost like you're not there. When people discuss your results or your treatment, you're just a number in a book, But here, everything's discussed clearly. Even your food, your lifestyle, supplementation, that sort of thing. So yeah, it's totally different. I mean, I would totally recommend it. Although my condition is still very, very serious. I mean, I'm sat here with tumours on my lung, my pancreas, and various other ones, lumps and bumps here and there. But I do think it gives me a quality of life. I think it keeps everything at bay. To come out here, I think it just gives you a new sense of hope, and it definitely works. It definitely helps, and hopefully I'm a good advocate for that. Yeah, I came here and I wasn't feeling very good, after seeing all the various therapists and the doctors and everyone else, and when I left, I did feel totally amazing. And when I had my CT scan, when I went home, I had a big tumour on my lung, which we were thinking of doing radiotherapy on. And by the time I went home, after 3 virotherapy injections and a week of doing this holistic sort of approach, the tumour was totally gone. And also I find the support even from England on the phone, if I need to ask the doctors anything, what they recommend. I mean, I was in hospital recently, and you know, I can phone from the hospital and I get to speak to a doctor directly straight away. And again, in England, that doesn't happen. So yeah, this is my 3rd time back here, and I just feel at home here. This time I've come alone, which was a little bit scary, but everyone's looked after me and made me feel welcome, and they've looked after me very well. When you get a diagnosis, it's very scary, but I think, first of all, don't listen to mainstream doctors. I think look outside the box. I think the doctors that I am in contact with in London, for instance, they are treating a tumour just as a tumour. They're not treating you as a whole person, okay? There's more to that end result of a tumour than, it doesn't just come for no reason. So I think, you know, look for alternative treatments, look for safer options, look after yourself properly, and you can get all of that advice here: nutrition, psychotherapy, acupuncture, things like that, so that you can, you know, so you're not just bombarding your body with toxic things that are going to make you feel worse. And know that there is hope. There is always hope. I'm 8 years with a serious malignant melanoma diagnosis. It's metastasised all over my body, but I'm still here. I'm still smiling.